How many of you have gone to clinical or work and been physically, emotionally, and mentally exhausted and just in need of a break?
I have.
So we need to stay, sit, and energize.
We're exploring the relationship between nursing breaks and energy levels through the perspectives of nurses in different workplaces.
What we're asking is, what are the perspectives of nurses who stay in the break room during their break on feeling energized after?
For our first literature review, this literature explored the type of break room nurses preferred and emphasized the lack of sufficient times for nurses to take breaks, which we found in our study.
Literature review number 2 explored the effect of rest breaks, and the nurses reported significantly lower levels of fatigue when they took their rest breaks.
For literature review 3, there was a study done to see how mental breaks during a rest break would help reduce fatigue, and it found that taking mental breaks was associated with having less fatigue. But when workload was very high, the effect of a mental break was lower.
For literature review 4, this one compared people that take breaks in the garden and people that take them in the break room. And they found that nurses that took their break in the garden showed statistically significant less emotional exhaustion and depersonalization from their work.
This is Addie on hour 6, taking her 30-minute rest break.
I feel so much better. My patients are in need of my care, but I feel energized and I can't wait to get back to work.
Our sample consisted of 14 nursing students, nurses from hospital, long-term care facilities, and clinics, and we collected it through a survey with multiple choice, open-ended, and a Likert scale.
So for our data analysis, we used a thematic analysis to identify patterns with the open-ended question responses, and then we also did a descriptive analysis to create percentages.
21.4% of our participants take breaks in the break room. 78.6% do not take breaks in the break room. 21.4% do not get any breaks. 28.6% reported doing work-related tasks during their break time. For example, documentation, answering emails, and seeing patients. 57.1% reported a significant difference in energy levels after their breaks. They also reported feeling less tired, being able to focus better, feel more motivated, more patient, and being able to connect better with colleagues. 64.3% take a 30-minute break. 35.7% get on their phone during their break, and 57.1% eat during their break.
Our findings reinforces our literature review, meaning both our study and the literature reviews has shown that breaks improve nurses' mental capacity and energy levels. You may be wondering, why does this matter? Well, all of us intend to become nurses, and the energy levels and well-being of nurses directly affects patient care outcomes.
I know that was a lot of information, but one thing that this entire group decided on as a recommendation is, based off of this research, it is imperative that healthcare organizations should ensure that nurses are able to take regular, uninterrupted rest breaks during a demanding 12-hour shift. It is evident through the support of our research that these rest breaks reduce acute fatigue and support recovery. To make sure that this happens, strategies such as ensuring adequate staffing, creating quiet break areas, and promoting a workplace culture that values rest as essential for patient safety and nurse well-being. We hope you enjoyed our project, and don't forget,
Stay, sit, and energize.